Now, turning to our program, Director of Marketing Communications at the Medical College of Wisconsin, Holly Botsford, will introduce our speaker.
Good afternoon. It is my pleasure to introduce Dr. Megan Schultz. Dr. Schultz is a pediatric emergency physician at Children's Wisconsin and an assistant professor of pediatrics at Medical College of Wisconsin. She completed medical school at the University of Wisconsin, her master's in education at Johns Hopkins University, never heard of it, and her pediatric residency at Massachusetts General Hospital, Harvard University. Before graduating medical school, Dr. Schultz worked as a high school teacher in Baltimore with Teach for America, as a project coordinator in Boston with Partners in Health, and as a program director in the Dominican Republic for Health Horizons International. She is currently director of the Global Health Pathway for medical students and the director of Global Child Health at MCW. Dr. Schultz is a passionate servant leader. Please help me welcome her to the stage.
Hi, I'm Meg. I'm a pediatric ER doctor, and I just really wanted to thank you for having me. I'm going to be talking about gun violence in children. This is a difficult topic. It's not a fun topic, but I think we do need to talk about it if we want to change it, so I just really applaud you for having me. I also want to forewarn you, I'm probably going to cry during this talk. It's not your fault. I'm okay. As my colleagues can attest, I cry all the time. But I cry because this is a devastating topic. It, frankly, sucks to see children die of gunshot wounds, and it is bewildering to me that we're not all crying about it all the time. So I heard you guys like roadmaps. This is my roadmap for the day. I'm just going to present some facts about gun violence in children, and then offer some personal experiences as an ER doctor at Children's, and a few patient stories. And then talk about physician advocacy. More and more medical providers are becoming involved in advocating for gun legislation, including us at Children's, and then what you can do as community members and business owners. So just to start us off, guns are now the leading cause of death in children in the United States. So the graph that is above here, the top orange line is motor vehicle crashes, and the bottom line there is firearms. For many, many, many years, motor vehicle crashes were the number one cause of death in American children. Around 2017, 2018, as you can see, those lines crossed, and guns became the number one cause of death of children. That just skyrocketed during COVID. This graph shows that this is a uniquely American problem. So no other wealthy, developed nation in the world has anything near the amount of gun mortality rates in children as the United States. That top green line is the number for the United States. 6 children die per 100,000 in America. The country that's second on that list, Canada, is not even close to us. We far outpace their gun mortality rates of children. We're 10 times higher than Canada. A place like the United Kingdom, we're 100 times higher. I wanted to take a second here because my other role, as you heard, is the Director of Global Child Health at Medical College. And in that role, I get to work with and meet a lot of amazing physicians from all over the world. One of those doctors, Dr. Abebe Bekele, came and visited MCW and Children's and Freighter last summer. He was giving grand rounds at the Department of Surgery. As Director of Global Child Health, I gave him a tour of Children's. It was Tuesday afternoon last summer. He's a surgeon by trade, so I showed him the ORs because, surgeons like that stuff. And then I showed him the ER because that's my favorite part of the hospital. And on that Tuesday, as we were entering the ER, a 3-year-old child had just been shot. She was playing at a playground in Milwaukee with her grandma, I believe, and swinging in the swings, caught in the crossfire, shot. When we got to the ER, the trauma team was just leaving the trauma bay and going to the OR to do an emergent X lab. And I immediately fell into my clinical role. I started asking my colleagues, what happened? How many entry wounds, exit wounds? How's she doing? What was her blood pressure? I look over at Dr. Bekele, and he is a tall guy, his 50s. He's Ethiopian he was born and raised there, trained there as a surgeon. Now he lives in Rwanda. He had tears in his eyes. And I was like, oh, are you okay? And he said, a 3-year-old has been shot. And I was like, oh, yeah. Sorry, we see this all the time here. It doesn't necessarily make me cry all the time anymore. And of note, Ethiopia is currently going through a civil war, and where he's from, and Rwanda, where he lives now, has seen the worst genocide in modern human history. And he said, his tears were falling from his eyes. He said, I cannot believe in America, the richest country in the world, 3-year-olds are shot at playgrounds. Are you living in a war zone? And it was just a good reminder for me that it does feel like that. It does feel like we are living in a war zone. Guns are the leading cause of death among children, not only in the United States, but also in Wisconsin. An average of 58 children die every year in Wisconsin due to guns. 31% of these deaths, and this is for all gun deaths in Wisconsin, 31% are homicides and 65% are suicides. That's not necessarily directly pediatric data. I just wanted to highlight it because so many gun deaths are suicides. All these stats that I've gone through so far really focus on mortality rates, which are awful. But I think it's also important to note that these statistics do not really cover how extremely devastating gun violence is to families and communities, even when people survive. A child who is shot by a gun has even if they survive, have lifelong effects. We see these kids all the time in the ER. They come back, they were shot 2 years ago, and now they have chronic pain, and they're addicted to oxycodone. They were shot 3 years ago, and now they're paralyzed on the right side of their body, and they can't, move, and they're in a wheelchair. About 2 or 3 years ago, I was in the ER, and it was a twofer, as we call it. There were 2 little babies who were there for like a cold, essentially, and their moms had brought them in. Their moms were sisters, so the little babies were cousins, and the babies were like totally fine. They were like a little congested, and so I'm sitting and talking to these moms about like your baby's fine, they have a cold, and there's only so much an ER doctor can say about nasal congestion. So I was like, what's going on? Like, you seem more distressed than these babies are. Like, can I help you? So I sat down and, I was like, what else is going on? And the moms, the sisters, they said, we're not really here because of our kids. Our little brother died here about 3 days ago. He was shot, and we got a phone call that he was dead. And we just wanted to see the place where he took his last breath. And I just really identified with that. I have a little brother. And how horrible if he had been shot and I didn't get a chance to say goodbye. So I took them to the trauma bay. I had not cared for their brother. I was not his doctor, but I did everything I could to help them grieve in that moment. I took them to the trauma bay, and I just kind of talked about what happens with a level 1 trauma like a gunshot wound, and how we always try to make a death as humane and as painless as possible. But I just share that story because it's not just the children themselves who are so deeply impacted by gun violence, it's the entire family, it's the entire community. This is data specifically from Children's Wisconsin, just to describe some of the acronyms here. GSW is gunshot wound, CW is Children's Wisconsin. So this is firearm injuries from the last 5 years. As you can see, in 2019, we saw 53 GSWs in kids. Last year, in 2023, we saw 149. This is a 250% increase in firearm injuries in just 5 years. Deaths have also increased, as you can see, over the last 5 years. That last column, GSW deaths in kids, is from the Milwaukee Homicide Review Commission, and I included that just to show that not all kids die at the hospital. Some of them die in the field. So these deaths are happening at basketball courts and playgrounds and homes. Paramedics are calling the deaths in the field. Homicide by firearm has been the leading cause of death for children in Milwaukee since 2011, so we were actually ahead of the American curve, which I showed you had started in 2017, 2018. This number too, the 149 kids we saw shot last year, that translates to about one child shot every 3 days at Children's. So I work, 3-4 shifts a week. That means I will see a child shot at least once a week. The most I've ever seen is 3 shot children in one day, in one shift. I came from Boston. I did my training at Mass General, and it's different there. Massachusetts has stronger gun laws. Gun violence just really wasn't a huge part of my training, a pediatric training. I would argue it really should not be. I think pediatrics and children, we should be thinking about things like Friday night football games or Dr. Seuss or bubbles or bicycles. We should not be thinking about getting shot in the head and seeing a skull shatter, which I've had to see as a pediatrician. In Boston, like I said, I only saw 2 gunshot wounds in children over my 3 years there. When I moved to Milwaukee in the summer of 2015, I saw more than that my first week. So my first week as a pediatric emergency fellow at Children's Wisconsin, I saw 3 kids shot. I think, I've probably gone through like stages of grief with this. As a woman, as a mother, as a physician, at first I was shocked. I could not believe how many kids were shot by guns here. And then I probably tried to kind of remove myself a little bit, get clinical about it. How do I become the best trauma physician I can? How do I, what antibiotics do I give when the bones have been broken from a bullet? What medicines do I give when there's brain swelling from a bullet that's entered the head? But after that, I became angry. It became really, really maddening that my colleagues and I are dealing with this and seeing this, that these families are dealing with this so often, and it seemed like no one was talking about it. I want this to be on the front page of the newspaper every day. I think this should be on billboards all over the city. Our children are dying of guns. Like, we did this. This is a man-made problem. I got so angry that I wrote an essay about it. So the Milwaukee Journal Sentinel was kind enough to publish it. This was July of 2022. And I just talked about how deeply, deeply traumatic it is to see children shot over and over and over again. I'd like to read a quick excerpt from this just because I think it depicts my anger. After codes and traumas, we tried to hold debriefs for the medical team. The debrief is a time for people to ask questions, offer suggestions, clarify the reason for medical intervention or lack thereof. After one such shooting death, I stood at the head of the bed in the trauma bay and I talked to nurses and respiratory therapists about the code. What could have gone better? What did we learn? What will we do next time? Because we all know there will be a next time. Questions were asked, tears were shed, and gradually people filed out of the trauma bay and back to work. The hospital chaplain lingered next to me. Once the trauma bay was empty, save him and me, he turned to me and took both my hands in his. He said, "I don't know if you believe, but I want you to know that you are doing God's work. You are a soldier of God." Is it God's work to hold mothers upright as their knees buckle, screaming and screaming after their child dies because of a gun? Is it God's work to see brain matter burst out of a bullet wound in a child's skull after the pressure becomes too great? Is it God's work to review a CT scan after a bullet has shattered a hip, destroyed an iliac artery, and ripped through the colon, shackling the child to a wheelchair, a colostomy bag, and a lifetime of PTSD? Maybe the best part of writing that essay was the response I got, which was overwhelmingly supportive and positive. I had called out politicians in that article saying, please help us. We cannot do this alone as physicians and medical providers. We need laws. And I got dozens, maybe hundreds of responses from people in complete support. People from all over the country, doctors, nurses, therapists, paramedics, police officers, a nun, a priest, and they all agreed we need change. I actually just got this letter like a couple weeks ago. It was from a veteran. And now I can't read it because it's too far away. Maybe I can read this one. Back in July of 2022, I read your article. and was so touched by it that I clipped it out and still read it every so often. I'm a 4-year veteran of the Marine Corps, and it still makes me cry when I read it. I want to say thank you for writing the article and telling all the politicians how most of us feel. In the Marines, we were taught to never leave anybody behind, but that is exactly what these politicians have done to a segment of society that are the least able to protect themselves. From that response, I realized that many, many more people feel this way than I gave them credit for. So my colleague and I, Dr. Ryan Shepard, wrote another article that the Milwaukee Journal-Sentinel was also kind enough to publish. This one, we asked for specific legislative change from our Wisconsin state politicians, 4 specific gun laws that I'll go into in a little bit. The most moving part of writing this article was that after we wrote it, before it was published, we just spread it around to our friends and colleagues at the hospital. We printed it out, we handed it out, emailed it, and said, if you want to sign on to this, let us know. Just from that word of mouth, we got almost 200 signatures from all over the hospital. Everyone from the secretaries who answer our phones to trauma surgeons to physician assistants, mental health therapists. I was so incredibly touched that so many people are, dying for change. So that leads me to say, what can we do as physicians? I know that gun violence is seen as very political, very partisan, very hot button issue. I would like to argue that it doesn't need to be at all. We need to treat gun violence like the public health epidemic that it is. We as physicians are used to advocating for the safe, healthiest choice, and we can do that for gun violence. This is very common for pediatricians to do. Children, as you may know, are always making ridiculous choices, like, eating this weird thing or falling out of this weird, trampoline. So pediatricians are used to advocating for safe interventions that make them more safe. So this guy, Murray Ketcher, he was one of my professors at UW. He was sick of seeing kids with hot water scald burns. Back in the 1970s and 80s, hot water temperatures, like the industry standard once they left the factory, was 150 degrees for the temperature to be set at. At 150 degrees, children's skin, because it's more fragile and thin, can get a full thickness burn in just 2 seconds. So Dr. Ketcher was like, that's ridiculous. We just need to change these hot water heaters. He advocated first at the state level and then at the federal level. And in 1987, we passed a law to regulate standard water temperature settings. This is something that we do all the time. Similarly, there's this physician back in Boston, Dr. Haddon. He was very nerdy, and he went to MIT and Harvard, and he was like, we need to figure out an objective way to take a disease process or a public health crisis and really delineate all the different ways we can make that disease less traumatic. So he separated it out to the event, pre-event, and post-event, and then going across the top, personal factors, the agent itself, physical environmental factors, and societal environmental factors. So for example, for motor vehicle crashes, if you take, the pre-event is before the crash occurs, the event itself is the crash, and post-event is after the crash. What can we do for each of those lines going across to make driving safer, to make motor vehicle crashes less traumatic? Well, we can make sure that every person has a driver's permit and has to go through a class. We can make sure there's guardrails on roads. We can make sure that the cars themselves are safety and have anti-lock braking systems. This is objective, research-driven public health intervention that I think we should apply to gun violence. So there are things we can do, not just laws. Laws are part of it, but this can be a comprehensive public health approach. Everything from suicide hotlines to making guns themselves, like smart guns, more safe to use. It does not have to be political, is my point. We can do this. We've done it before, and we can do it again. So what is Children's Wisconsin doing? A bunch of stuff. Part of it is research. And quite unfortunately, in 1996, the Dickey Amendment was passed in Congress, which essentially censored all gun control research in America. That Dickey Amendment was not lifted until 2018. So for 20, 25 years, really no one could study how to stop gun violence. Thankfully, that was been lifted, but we're about 20 years behind. We have several physicians who are working on gun violence research, including Dr. Levis and Dr. Katie Flynn O'Brien. They're doing things like starting a trauma-informed follow-up clinic for violently injured youth and studying how the brain is affected after a violent injury. We're also doing community interventions like Project Ujima. Project Ujima offers community-based services that are culturally and developmentally appropriate, including medical care, education, crisis intervention, and peer support. We're also offering gun locks and safes, for a long time, our social workers have been doing this, offering gun locks in the hospital. And just recently, my colleague and I presented to the Medical Society of Milwaukee County, and they offered us a grant to buy more gun locks for parents that we see in the ER with guns in their home. And then lastly is just education and awareness. Doing things like this to talk about how prevalent gun violence is and how we can stop it. Children's also has something called the Advocacy Network, CAN, which is a grassroots network of 10,000 children's providers, leaders, staff, and board members, as well as patients and community members who are committed to speaking up on behalf of kids in Wisconsin. If you want to sign up, there's a website there. So what can you do as a private citizen and community leader? I do have to preface this section by saying I am a doctor, and so I will always advocate for the safest and healthiest choice, even if you don't like it. If you are a pack-a-day smoker, I know you love your cigarettes, but I will always advocate that you stop smoking. So here's my list. And number one is get rid of your gun. So I would just like to stress that we have shown, many research studies have shown that you are not safer with a gun. There is a common myth and misperception in our society that you are safer with a gun. Specifically during COVID, gun ownership rates skyrocketed, primarily because of anxiety. However, adults who live with gun owners are twice as likely to die of homicide than adults living in gun-free homes. This is specifically worse for women. Women are 3 times as likely to be murdered if they live in a home with a gun. Women also are more likely to die by gun if they themselves are the gun owners. And this is something I talk about with women who, even in my own family and friends groups, who have purchased guns. Even women who think they are protecting themselves by owning a gun are less safe by having that gun. Multiple studies have found that the risk of suicide is dramatically increased by having a gun in the home, anywhere between 2 and 10 times more likely. And then last but not least, 74% of guns used in school shootings were obtained from the student's home or from the home of a family or friend. If you absolutely cannot get rid of your gun, then I advocate that you store it safely. And just to be clear, safe storage means storing guns locked, unloaded, and separate from ammunition. I will say this is a sticking point. When I talked about this in the ER, a lot of people think that having the gun loaded and very, readily used is why they have it. It's to protect them from a home invasion. I don't know what they think they're protecting themselves from. However, but research has shown that guns that are loaded and easily available make you less safe. You're more likely to die from a gun. Oopsies. Number 3 was talk about gun violence. One of the reasons I'm so glad to be here is because you all are community leaders. And I think we need to be talking more about this. I would push you to talk about gun violence with your friends and neighbors, your family members, your children. Ask your pastor to give a sermon about gun violence. Ask your physician if they're asking about guns in the home for their patients. Specifically as a mom, I always ask about guns in the homes of my kids' friends. This can be really tricky because, again, guns are kind of a hot button issue. So I just wanted to offer some kind of scripting for you if you are intimidated by this ask. This is how I say it. Before my kids go over to someone's house for the first time, I always ask them safety questions, like, do you have any pets, any allergies? If we're going to drive somewhere, do you need a car seat? And then if you have guns in your home, how do you keep them stored? This is sort of a less triggering way, no pun intended, than saying, like, do you have guns in your home? You just say, if you do have guns in your home, how do you keep them stored? One thing that I think is interesting is that not a lot of people know that guns are the #1 killer of children. Even when I just presented at the Medical Society of Milwaukee County, there were physicians there who did not know that guns were the #1 killer of children. And I think the more that we talk about it, the more, hopefully, the more distressed and concerned people will be. Number 4 is vote and call your legislatures. So just to prove this point, gun laws have been proven to be effective in many other states. This is one study that was published in Epidemiology last year, showing that state gun control laws like background checks and waiting periods reduce overall gun deaths, including homicides and suicides. These authors estimated that state gun laws passed in 40 states from 91 to 2016 prevented 4,000 deaths in 2016 alone. So gun laws do work, and there are 4 specifically that you could advocate for as a Wisconsin resident. Wisconsin currently does not have these laws, and all of them have been proven to work and be safe for other states. So number 1 is background checks. This is like the lowest hanging fruit. It is widely supported in a bipartisan manner. 87% of Wisconsinites, including 83% of Republicans, support universal background checks. And one state that passed a universal background check requirement saw firearm homicides fall by 40%, whereas in a state that had eliminated its permit to purchase law, firearm homicides rose by 25%. The other is the domestic abuse loophole. This is specific to Wisconsin. We have this loophole where because domestic violence is considered disorderly conduct, people who are convicted of domestic violence do not necessarily get their guns taken away, as in other states, because they were just disorderly conduct. Wisconsin actually has a huge problem with domestic violence. We rank 8th in the country in the number of women murdered by men. And a woman in an abusive relationship is 5 times more likely to be killed if her abuser has access to a gun. So this is something that you could do today. Call your lawmaker and ask for to close the domestic violence loophole. Then the extreme risk law is also widely supported in bipartisan nature. This essentially gives police and families the power to take away a gun from a person who is at risk of hurting themselves or someone else. A Marquette Law School poll just last year found that 85% of Americans want extreme risk laws, including 83% of gun-owning households. And this is a huge problem in Wisconsin, where 65% of all gun deaths are suicides. Connecticut passed a law like this, and they had nearly a 14% decrease in gun suicides. And then lastly, there's a safe storage tax incentive that's up in Wisconsin right now. Guns that are stored locked and unloaded, guns are stored locked and unloaded, as is safe, in only 3 out of 10 gun-owning households with children. So roughly 4.6 million children in our country live in a home with a locked, unloaded gun. This law essentially just takes away the sales tax if you're going to buy like a gun lock or a gun safe. I would advocate one step further in making gun manufacturers or gun dealers required to sell a gun lock or gun safe at the same time that they purchase your gun, but baby steps. We'll start here. Number 5 is invest in the Black community. So very purposefully have not talked about race yet with the gun violence epidemic in Milwaukee County, not because it's not important, but because I have found that too often white people use race as a reason not to care about gun violence. And I know that because they've told me. Some of the letters I received after my editorials said things like, Milwaukee does not have a gun problem, it has a black male problem. Even one of my own colleagues at Children's, I was giving a talk about gun violence, and one of my colleagues said, you know, it's sad when a kid dies from a gun, but like it's so much more sad when a baby dies of an infection because they didn't deserve it. And I said to him, as I will say to you now, No child deserves to be shot by a gun. And we, as pediatricians, care for all the children in every neighborhood, no matter what their skin color is. 78.5% of the children we see shot at children's are Black. And Black children in Milwaukee County are 7 times more likely to be killed by guns than their white counterparts. Gun violence is definitely a racial justice issue, and I honestly just find it deeply disturbing that people use race as a crutch to get out of it. Are Black people not human? Why would you not care about kids getting shot if they're Black? So gun violence is definitely linked to urban poverty, inequality, and segregation, all of which has happened to Black communities in Milwaukee County for decades. So I think by investing in the Black community, we can also decrease gun violence rates. That means employing and insuring Black people, supporting Black-owned businesses, supporting public schools and mentorship programs in Black communities, donating to Project Ujima and 414 Life, and then learning about community violence intervention efforts like Running Rebels and Credible Messengers. Lastly, promote media campaigns. So I really like to use cigarette smoking as an analog to gun violence because we have been pretty successful here in the United States at decreasing cigarette smoking. I don't know if you remember, like 50 years ago, people were smoking on airplanes and smoking in hospitals, and it was just totally fine. And I honestly now, in like 2024, can't remember the last time I saw a cigarette. My 5-year-old saw someone smoking, I remember a few months ago, and he was like, "Mom, what is that?" I was like, "Oh, we have come so far. This is a public health intervention that worked." So I think we could kind of use this as a template. It wasn't just the scary, gross advertisements that I've shown here that were effective in getting kids to stop smoking. It was also things like making cigarettes less cool. Cigarette companies were no longer allowed to have magazine advertisements. They were no longer allowed to advertise to children on children's TV shows or in children's literature. And even like billboards for smoking were outlawed. This definitely, all these different things, all these different public health interventions worked with smoking. In 2011, 20% of young adults aged 18 to 24 years smoked. And now in just last year, that rate was 4%. I mean, it has precipitously declined. And I think it's largely because of our public health efforts. So final thoughts, and I'm doing okay. I just want us all to really sit with the fact that guns are the #1 killer of children. I think we read statistics, and it doesn't necessarily portray how absolutely devastating that reality is. So I think I don't want you to think about this. I want you to talk to your families about it. And then I also want to stress that this is a public health emergency, and I think if the #1 cause of death was, rabid lions, you can bet that there would be a very huge public health push to get all the rabies out of the lions. I need that level of energy about guns. And then lastly, is this how we want to live? I am very aware that gun culture is a part of the American identity. I am aware that gun owners feel like this makes them more independent, or there's like this history of American being revolutionaries. That culture and that identity has led us to here, where our kindergartners are learning how to react to a mass shooting in their school, where middle schoolers are getting shot at Super Bowl parades, and on average, 13 American children are shot every single day. Since we've been here in this room together, 1 child has been shot. And I just don't think that's how we want to live. Thank you.
Thank you, Dr. Schultz. We'll move on to our Q&A session. So if you do have a question for Dr. Schultz, you may use this microphone here. And as always, please keep the questions concise and topical.
Thank you. So it's probably not a shock that I'm the first person to ask a question, but I just want to first of all say thank you. And you know I'm one of your biggest fans and deeply appreciate your voice. As medical professionals, as she mentioned, she sees the blood, the trauma, and the impact on a daily basis. 4-1 for Life on the adult side, this is the pediatric side in terms of Project Ujima, works with adult gunshot survivors in the city, and we also experience the same trauma. If all of you have a cell phone, I want to encourage you to go to 41forlife.com. And on that site, you can view Milwaukee's Blueprint for Peace. It was a comprehensive violence prevention plan rooted in public health, launched in 2017, and coincided with a steady 3-year decline of homicides and non-fatal shootings in this city. And I would implore you to ask the city, the county, and anyone asking for your vote, where are they on that plan? Are they still committed to it, and are they invested in it? Organizations like Children's, like Freighter, the Medical College, Milwaukee County, the city, and others have all invested in programs like 4-1 for Life in this issue. But not one program, not one institution, not one entity, not one advocate can do it alone. All of you represent companies, institutions, and agencies and neighborhoods in this city, and we need all of you to be involved in this movement. So thank you so much for elevating this issue and for your courage and compassion. Thank you.
Thank you for being here and for what you do. About 25 years ago, I did work at Children's Hospital when Project Ujima the concept was being developed and instituted, and it's heartbreaking to think of where we are today. I have two questions, I guess. I know Children's Hospital has an initiative to work on mental health and is working down to the pediatric level to make sure that there are questions and points that they want to probe when the child's in for routine checkups. Is the gun safety issue part of that? And if it isn't, it really should be. So I just thought I'd mention that first. And
Only
then I
speak to
have
what we do in the ER. So we do screen all children over the age of 11 for suicidality or like suicidal ideation or behavior. They get an iPad so they can answer the questions by themselves, away from their parents. Do you have thoughts of harming yourself today? Have you ever tried to commit suicide? We do not currently have anything like that for gun use, gun violence.
and I forgot my other question. But again, thank you. This is a horrifying issue for all of us.
Thank you, Megan. Carolyn and I were very proud to be your neighbor for 5 years in Shorewood, so welcome here again. Wanted to ask too, you mentioned COVID and how gun violence skyrocketed during that time frame. And of course, now we're in the endemic phase, but yet gun violence continues. I want to just touch on the pandemic and how that has played into its own epidemic of gun violence in Milwaukee.
Yes. So a lot of things happened during COVID. I would argue that some of it was just a societal breakdown of trust. Many people became more anxious during that time and felt the need to arm themselves. I think there was just many more divisions wrought amongst us. People were more likely to distrust their neighbors than trust their neighbors. And then part of it also was that people were at home all the time, including kids. Things like school, after school programs and sports is a great structure for children. And when they were at home for a couple years, a lot of them did not have the structure that they needed. And then also COVID disproportionately affected people of color and poor people. If you don't have enough food to eat, you're not really going to have the mental health to be able to I'm going to start a new hobby of knitting during this time at home. If you're stressed because, you can't afford your heating bill, that's going to lead to despair and hopelessness, which has been proven to also lead to gun violence.
Hi, thank you so much for your courage and your advocacy. I'm Joan Johnson, Milwaukee Library Director. What you said about being able to raise awareness around this issue and to be able to just sort of scream it at the mountaintops and put it on billboards. I want to be a partner in helping spread the word. I mean, at the library, we increase literacies around all different topics, and this is a very important topic. Health literacy is one of the areas that we are working in, and I would like to have anyone who's sitting in the room, who is, especially those of you that are here today with our guest Megan, if you know of people that I need to be in touch with and that I need to put my staff in touch with to help create venues in the library system. We have 12 branches in the central library and a virtual 24/7 library where we can share information about this issue and have programs and presentations. If there's a speaker circuit or a speakers bureau, we want to host.
Thank you very much. Do you find that in households with guns that parents and families do any education about guns, about the purpose of them, the use of them, the safety of them, the risks of them, or are they sort of hidden on the closet shelf for the kids to go discover, like that box of cookies?
That's a great question. So this is anecdotal. I have found that, so we know that any choice driven from anxiety is not a good choice. The adults who have purchased guns out of anxiety because they feel unsafe, they want to secure their home, usually do not talk about it with their kids, and the kids find it. So, I mean, that happens all the time. We had a kid whose mom had just bought a gun because she had felt unsafe in their neighborhood and left it on her bed and went to work, and the kid found it within the first week of purchasing the gun, and the kid found it and shot himself. So I think education does probably happen more in families where, like, for example, one of the parents is a police officer and, they have to be armed at all times, or they have to bring their firearm home. Just anecdotally, again, I've heard more families say, I have to have a gun at home, but my kids know not to touch it. So I think education definitely varies within families. I would also just say about the latter group of I hear a lot from parents like, oh yeah, we have a gun, but my kids know not to touch it. I would just turn that back on you and say, have you ever been a kid? Because kids know where everything is. They will get into everything. When I was 8, I knew exactly where my mom's little secret cash deposit was. If you were a teenager, you knew where your parents kept the beer. Kids find stuff all the time. And then the other thing too that I would just say is that educating your kids about the gun in your own home also does not prevent gun violence that happens outside the home. So very, very commonly we'll see, my son went over to a sleepover at someone's house, and that house had a gun, and all the little 12-year-olds were playing with it, and one of them got shot. So the education of what to do with a gun in your home doesn't necessarily reflect then what to do if you find a gun outside the home.
This will be the last question.
Thank you for what you're doing. Is there any statistics on number of guns that are illegally used in these shootings versus those taken from home?
Do you know that? Kira's coming. I don't know, but he does.
Hi, I'm Mike Levis. I also work with her job. So there's not straight statistics. We know that the vast majority of the guns that get into the market get in legally. And there's a lot of misconception about this idea that all these guns are stolen. Most of them are actually gotten either through straw purchasing or on the secondary market. So there's to the point that Meg was making about legislation around background checks and waiting periods. I can buy, there's a background check if I buy from a gun dealer, but if I buy from Meg, there's no check at all. So we don't know how many times guns have passed through before they get into these situations where the youth is shot. And for straw purchasing, that means that someone legally bought it for someone who can't legally have it. And those, there are certain measures that you could take, that we could put in place that could limit those type of straw purchases. Some of it would be lengthening the waiting period so that you can do a further background check. But yeah, there's not really good numbers on how many are stolen, but I think it's probably far less than the public thinks are stolen.
Thank you, Dr. Schultz.